You're listening to the Patient Advocacy Now podcast, presented by Greater National Advocates.
It's just gut-wrenching sometimes. Like, if it's sad and they're crying, I might cry.
Amazing how many doctors do not even want to treat somebody who has Medicaid.
Medical system is about making money.
And I said, so are you hiring more nurses, or you're just telling each nurse to work harder?
Debby Deutsch, welcome to the Patient Advocacy Now podcast. Thanks for being here. Looks like a beautiful day where you are.
It's gorgeous. It is gorgeous.
Yeah. Always nice. That makes everything a little bit easier. I find when you can look outside and there's just clouds and clear skies and things like that.
Well, I'll tell you, we have long winters in Wisconsin, so we really, really appreciate summertime here. Summer goes very quickly.
Yeah. How long does the season last for you?
Oh, it starts December, I would say, through April. And April is when it gets very painful, when we have snow and you just want it to be spring and you want to see bunnies and tulips and lovely things. So
Yeah.
we welcome spring wholeheartedly.
Yeah, for sure. I can, being LA born and raised, I have never really had a real winter.
Oh.
So I, people's, my kids want the snow all the time. And I'm like, I don't know. I feel like it's overrated.
Yeah, it's cool. It's fun for Christmas and then you get tired of it. You really do.
Right. Makes sense. Well, you've been in the healthcare space for several decades now.
I have.
And you came into it originally as a nurse. Is that right?
No, I am not a nurse. I work with many nurses, and I've worked with nurses for many, many years. But I originally trained as a hospital chaplain. I was actually headed to seminary to become an ordained minister, and I trained at a hospital here in Madison, Wisconsin. I went to work for the hospital and then went to work for UW Hospital as a chaplain. And I was poised to start seminary, but in my training, I worked with hospice nurses. And I was like, wow, that is intriguing work. So I literally had to decide, do I go to seminary as planned, or should I listen to this large hospice agency that is recruiting me? And I went to work for a hospice group here in Madison and loved it, really loved it.
In what role? What was the title that you were?
I worked with the admissions team. So I worked with folks when they were entering the hospice system or thinking about entering the hospice system. And I worked with folks, met them in their homes, met them in hospitals, met them in care facilities, sometimes in clinics in an emergent situation. And really loved that type of work. But what it taught me was that, there are some patients who just kind of slip through, and I could see it happening. But I didn't have any credentials. I'm not a physician. I'm not an RN. I just had zero credentials. So all I could do was, kind of watch it happen, sadly, and, try to support as I could, staying in my role. And it really bothered me to see people just, not get what they needed. And I had the experience of being with my younger sister and my father within about an 18-month period, and both of them at end of life. And, being hospital, being bedside with them and acutely feeling, I wish everybody would slow down. I wish folks would explain to us what was going on. And that's a horrible feeling, really not a good feeling. And after my dad passed away, I thought, if I could go back to school and get some credentials and really learn about this, maybe I could help someone. And I stumbled on a program here in Madison with the University of Wisconsin Law School. It's a postgraduate certification, multidisciplinary program where I could study the art and science of patient advocacy. And I loved it. I loved being back in school. I loved just all the things I learned. And as I was studying, I was thinking, now, what can I do with this? How can I best help? And I really wasn't interested in working with a hospital system or working with an insurance company, because in my mind, you are working for the system who is paying you, and you can only really do so much for the patients and families that really need your help. So I thought, I'm going to hang a shingle and I'll see what happens. And I'm thrilled to say that this month is our 7-year anniversary. So we're 7 now. And I looked it up this morning, and we have helped 192 patients and families. And, some of them are from the very early days, and we're still supporting them. And that is a wonderful thing. We could not have done it without each and every of these patients and the families that by extension we're also helping.
That's so fascinating. You're the first chaplain that I've had on the show. And it's, what's interesting. We've had a lot of nurses, we've had people from billing,
Mm-hmm.
but in many ways, I feel like the chaplain role kind of addresses the hands-on personal kind of care that often advocates find that they're giving.
Mm-hmm.
Do you feel like that's an accurate statement?
I do. And I still draw on this training, I swear to you, every day. The big takeaway for me with my chaplaincy training is that I learned very well to meet people where they're at.
Mm-hmm.
And it doesn't, Madison is a very diverse population, and it's as likely that you're sitting bedside with a Methodist as with a Buddhist. That's just the way it is. And I had to learn a broad spectrum of, I think it was 138 faith denominations. But you learn that doesn't matter. It doesn't matter when someone's in a hospital bed, really. They're frightened, and they might be confused. They might be in pain. There's all kinds of things that are simmering up. And if you can manage to meet someone where they're at and form a bridge, that is everything. And chaplains are lucky because they can take time. And a lot of other, the other team members in the hospital, particularly if you're in an emergency room or an ICU, things are happening really, really quickly. So you can be that person who's kind of the constant and, making eye contact literally right beside the bed and holding the patient's hand and helping them through whatever it is. So it's holy ground for sure. But it taught me a lot that I have brought into my advocacy practice.
And what do you feel like was missing from the chaplaincy that you now put in advocacy, where you get your hands a little more dirty? It's not just addressing the spiritual and emotional needs.
Not at all, actually. I don't present as a chaplain.
Right, obviously.
But
I think the only thing that does carry over is you're spending more time, like you said, with the patients than like a nurse or a doctor might. Would you feel like that's valuable?
And the other thing that is really a big focus for us is understanding what the patient is dealing with today and understanding what the options are today, knowing that next week it could look very different depending. And we are not making decisions for anyone, but we are helping folks understand, okay, you've got this option, or you've got this option, or you've got this option. And this, this is what these various options might look like for you. And then letting the patient, supported by their family, make the best decisions for them, but remaining poised to help when something changes. And I promise you something will change, so we're right there, ready and able to help and pulling in other resources as needed. Excuse me. So that's, in a nutshell, I would say that is really the essence of kind of what we're doing, and really being an objective presence when a lot of other things are falling apart. A lot of healthcare situations are very emotionally laden, and we're the calm and steady, objective person persons who can kind of help translate what is going on in everyday language.
So is that how you view your role? Or, I mean, I know we've dealt with so many different kinds of advocates, and so many of them wear different hats.
Yeah.
Let me rephrase this. If I was a patient and came to you and said, what does an advocate do? What services do you actually provide? What would be, the elevator pitch of what it is that you would actually provide for them?
So what I would say is that we're translators. We're tour guides. We're helping folks. We're taking folks' hands and we're helping them down a path. And it might be a long and windy path. It might be a very short path from A to B. But we're helping them figure out the terrain, the local language, the shortcuts, and that is what we do. And we're not working just with elderly people. People assume that all the time. It's not just elderly people. I would argue that honestly, someone of any age, including someone who is not yet born, meaning prenatal, anyone at some point in their life can and should really benefit from a patient advocate, because we can help you navigate all those twists and turns. Excuse me for the cough.
That's okay. It's I think it's that the seasonal changing and everything that people are going through. So navigating through it. So are you, where do you guys find that people usually come to you at or find your services? Is it when they get multiple diagnoses? What's the most common time that people come into your fold?
We are very lucky in that we are starting, for the past few years, we've started to see a lot of word of mouth. People tell their friends about us helping them. I should say that I do have a team. This is not just me. I work with 4 really well-seasoned registered nurses. I also work with a social worker. And interestingly, we have a grief counselor, and we are all a team. Generally speaking, there are 2 advocates that are assigned to each case. And it's usually a very kind of specialized combination of nursing advocacy and case management. Sometimes there's some medical billing stuff that we do. Sometimes, as I said, we loop in a grief counselor, because interestingly, even if folks are assigned, if they're going through let's say they're going through a dire prognosis, we're talking about palliative care, we're talking about hospice care, we're talking about end of life, they might have an assigned grief counselor from their healthcare system or perhaps from their hospice, but for whatever reason, it's not a good personality fit.
Sure.
Additionally, because of COVID isolation, which we're thankfully coming out of, we're still seeing the effects of loneliness and isolation for many, many people during COVID. So those folks also can really benefit from some grief support. So we've identified that as a need. We constantly are listening to where folks are hurting. What is the pain that we can help stop? And that's how we identified that need. Back to your question about how folks find us. So a lot of word of mouth, interestingly, and I think we start
not just how they find you, but when they come to you, where in their medical journey.
Yeah. Ideally, it's right at the beginning, but that doesn't often happen. We've started to see, and this really tells me that we're doing something right, a lot of things right. We've started to see physicians call us, which is wonderful. That is wonderful, because when we're with a patient and we're seeing them in the clinic, let's say, or we're seeing them in the hospital, an astute physician can quickly see that we are swimming with this patient, from home to clinic to hospitalization, sometimes to rehab. We're going all through various parts of the healthcare system with them. And a physician can see, hey, as an advocate, you can help provide me with a lot of information that I can't get myself because I'm stuck within my clinic walls. So that makes us sing, honestly, when we get physician referrals. But I would say that folks really call us when they are at some pain point that they just cannot figure out themselves. They just can't. It's either their own healthcare situation, or it's mom or dad, or special needs child, or 20-year-old daughter, and for whatever reason, they thought they could figure it out, and they're running into brick walls, and they can't. Or a combination of, we don't have the bandwidth, we don't know how this works, and by the way, this is way too emotional for us to deal with. So we realize we need to call in some professionals to help us with that. And that's what we hear often. And we're happy to help with those types of things.
And how long do you say that people typically stay connected to you as advocates?
That is a really good question. And I'm very intentional of explaining this to people, because in my mind, part of, there's a lot of people say, oh, our health system is so broken. There's a lot of things that in my mind are not good fits. For example, let's say you contact some kind of home agency to help with either skilled nursing help or non-skilled nursing help. And they will say, we'd love to work with you, but you have to commit to working with us for 10 hours a week or 40 hours a month, or whatever their model is. And I understand that that's their business model. I take a lot of pride in the fact that we realize things ebb and flow. So I always tell folks, there are many weeks that you are not going to want to see us because things are going really well. Yay, that's wonderful. But make no mistake, when something happens, we are right there to support you. So, people might be hiring us for, a task of, we need to get dad into memory care. Can you help us with this? You bet. So it might be very short. Sometimes we can see from the get-go that it's going to be a long path, but not always. So if in fact it is a short case, we do what we were hired to do, go back to the patient and family and say, we have loved working with you. We think we've solved what you hired us to do. Looks like our work is done. We would like to close the case now. I promise you, more often than not, that the patient and family will say to us, oh my gosh, we have loved working with you. Can you just keep us on your caseload in case something happens? Of course we can do that. And that feels really good to us. So it's a matter of, we're there when you need us, and when you don't need us, it's okay, but we're always available to pick up where we left off.
And do you end up having some clients who stay on your caseload for years?
For years, yes. Through end of life, for years.
That's amazing. Yeah, no, that's a testament to the quality of the care that you guys are providing.
Thank you.
What role does the kind of the loved ones and the partners of the people who you're treating with play as an advocacy? Someone's husband, wife, their children, are you dealing with them mostly? Are you dealing with the patient themselves? Is it a mix? What does that look like for you?
It's a mix. It would be more tipped to the family if it were a dementia patient.
Yeah, makes sense.
Because, for obvious reasons, but we do a lot of, and we tell folks this right from the get-go, we do a lot of education, a lot of teaching, and a lot of coaching, because so often the patients themselves and the families, they don't understand how it works. They don't understand how referrals work within a medical team. They don't understand, it could be just as simple, and it sounds very, very simplistic, but they don't always understand that hospitals and clinics and systems are horribly overburdened. And it's, we have to sometimes fight to get them an appointment, to get them seen by their clinician, because the clinicians are so backed up. And the other thing that I promise you is a real thing is that the systems themselves are really forcing physicians and members of the healthcare team to kind of push these patients through their clinics as quickly as they can. And I have had physicians tell me, this is not why I went to medical school. I did not go to medical school to realize that I'm kind of pushing folks through my clinic because my system is saying, you've got 15 minutes at the most to see this patient. And the physician will tell me, Debbie, I would love nothing more than to explain to my longtime sweet little Mrs. Jones what her cancer diagnosis looks like, but I've only got so much time. And that to me is so sad. So we help cushion that and explain to folks, this is how it is. We're going to try to get the physician to slow down, make sure that your questions are asked, make sure that they're answered in a way that you understand. And then after the appointment, we're going to talk to you about everything that happened. And if you want us to, we will communicate with your family about what transpired in the appointment. But it's a lot of teaching and coaching and educating about how our systems work.
Yeah, absolutely. And that's one thing that is, I feel at least, sorely missed in the system as it stands. On that subject, where do you see room for improvement, since you're in it constantly in the current medical healthcare system that we have in the United States? Do you feel like if we fix this one thing, it would make my job a lot easier? Or are you kind of like, it's too complicated, the web's too tangled, I can't pinpoint one specific thing?
There is one big thing. It's funny that you asked me this, because I think about this a lot, but nobody's listening to me in regards to this. But what I would love to see happen, and I truly think this is needed, is, as we all age, if there was a way that we could kind of join hands with each other and come up with some kind of cooperative care facility where we're kind of taking care of each other as we're able, because I truly believe, I've seen this so many times, when folks realize that their care needs are increasing and they have to go into some type of care setting, whether it's assisted living or CBRF or skilled nursing, and their minds are blown, rightfully so, when they realize how expensive this is. And if there was some way, I know this is, a little Pollyanna, but I really do think about this, is if there was some way where we could do more of a cooperative model and make better use of Medicare and Medicaid dollars for the good of all. Oh, I would love to talk to legislators about that, but I don't really have time. To be really honest with you, but I do see that as something that could just be so beneficial for all of us, because we're, most of us are going to need this care at some point, and it's expensive.
Yeah, no doubt about that. I mean, maybe something to think about in those large retirement communities. It might be a kind of a fun pilot program to put in place.
Yeah,
Some of those Florida.
In Sweden, they have facilities that are college students and the elderly. That's beautiful. That's a lovely, lovely thing. So, I wish we could be a little more creative and a little more, it would certainly be cost effective, I would think. But
yeah,
I would just love to see
I like that idea.
Happen.
Maybe if we can value it as much as military service, and we can kind of reward some younger people for doing it. Kind of, there's definitely ways to think outside the box.
Outside the box, exactly, because so much of where we thought this was going, does it really make sense? I don't know. I see a lot of pain points with a lot of people, so it makes you wonder.
Yeah. What about the world of advocacy? How do you see that evolving? How have you seen that evolve over the last 5 years, 10 years? Where do you think it's headed?
Well, I was lucky in that I was among the first cohort that sat for the very first time ever offered board certification. And this was in 2018. So I was very conscious of the fact that we're a tiny little army. I think there were 118 of us, if I remember correctly, that passed that first wave of board certification. But what is very exciting to me is that the boards are offered twice a year. my understanding is that, we're growing, and that is wonderful because there's a lot of need for this. And I think that I love when I get the opportunity to talk to other advocates, in a workshop setting or some kind of large setting, because we're all soldiers in this, and we immediately can strike up a conversation very easily with each other because we're seeing and doing the same things, and we're trying to solve the same problems. So I think we're all pretty united in the fact that there's a lot of need. You can make a living doing this, but you've got to understand that you have to have a good business model. So that takes kind of a skill set that some advocates might not have, but you can figure it out. But I am encouraged and encouraging of other advocates because I do believe that the world needs us. And I truly hope that this is just a growing field. I do believe it will be. We're certainly not slowing down at all.
Well, speaking of that, if someone wanted to reach out and work with you and your team directly, what's the best way for them to connect?
Oh, you bet. We have a website, patientcarepartners.org. There is a 1-800 number on that. In all honesty, I'm the intake office. So if you call the 1-800 number, you get me. I also
That's an upsell, not in all honesty. That's a reason to call.
I'm sure my cell phone number is also on our website. So I'm easily available. I'm happy to talk to truly anyone, whether it's someone who is thinking this might be a wonderful career opportunity, or another advocate who might be, stuck on a case and wants another set of eyes. And advocates, by the way, do that all the time, and it's very, very helpful. I've reached out to many advocates over the years, and vice versa. Or a patient and family that's wondering if they might benefit from having a private patient advocate. And so many people, this is so interesting, John. So many people will call and say, I know there's senior centers out there, and I know there's lots of free groups that can possibly help. You bet. I refer all the time to those types of organizations, and thank God they're there, truly. But more often than not, that same person will circle back and say, I really appreciate that there are groups like this, but that's not quite what I need. I don't fit quite in their bucket, or the line is so long, I can't wait that long. So I really need to hire someone. Would you talk to me about that? So sure, happy to talk to folks in that situation. But I do refer constantly to kind of the for free help because it's out there. But what I will say is that so often folks say, I need more than that. My problem is such that I need more. I need more. So
I think that's how the advocacy profession was kind of started, by people needing more than what they got in the hospital.
I know, when my sister was hospitalized, I would have, oh my God, I probably can't even talk about this, but I would have been very grateful to have a patient.
How long ago was that?
10 years ago next week. Thus the tears, I'm sure. Sorry about that. But I remember acutely how it feels to have so many questions, and you just feel like you feel like the medical system cares, for sure. I mean, my sister got solid medical care, but what my heart really wished for was someone to take the time to really explain to us. And my family's pretty bright, but we were just lost in this world. So anyway, I just totally went off track, and I don't even know if I'm answering your question, but
no, that's okay. I mean, I think we all have those horror stories of just feeling lost and confused and in over your head.
And so vulnerable. You feel so vulnerable. And I remember that feeling. And I my heart goes out to someone who is in that spot because I remember it so well. And there are people that can help you, objectively, who understand, how these things work and can provide additional clinical information and just help figure it out. And, this is my diagnosis. What are my options? What do I do? Well, let's look at it. Let's unpack it. And frankly, that's where my nurses, who I just work so closely with, they can provide that clinical education to really
Mm-hmm.
help understand diagnoses. I'm not a nurse. I'm not a clinician. So it's our patients are really benefit from having that skill set on our team.
Let's have that URL one more time for how they can get a hold of you and your team.
Patientcarepartners.org is our website. I'm proud of our website. There's a lot to look at. There's interviews. We've been interviewed in the media. We've been interviewed by Fox News in Milwaukee a few times. So there's things to look at. There's things to read. There are testimonies from real people that we've worked with. There's some video.
And you work nationwide these days with being remote and everything, right?
We work nationwide depending on what the need is. COVID blew our socks off because we very quickly realized we had to pivot to secure platforms that were virtual and just incredible. And we started to work with folks that we realized we were never going to meet, in a room together. We would meet them virtually, but they were in Arizona or Nevada or Virginia. It just was mind-boggling, but it really cemented the fact that the needs are real. The needs are everywhere. And let's just try to help as we can. And that would, if there's a blessing from COVID, that would be one of them. We realized that we could do what we do over large spans. It was mind-boggling, actually.
Debby Deutsch, thank you so much for being here and sharing your story and your wisdom. I really appreciate it.
Thanks for having me.